with Daniel Abengrove in the Buffalo 14216 area code.
Good morning, Kayla. Today we will be doing an in-depth neighborhood analysis concerning the social determinants of health.
This location has a population of 22,979 and a total of 12,302 housing units and an employment rate of 68%.
Thank you for the insightful numbers, Kayla. If you take a look here, on the south side of the area, sidewalks are great. Roads are intact, especially by Starrett Avenue. Many people are seen walking their dogs, riding their bikes, and going for a run while appreciating the blooming trees. But on the northern side of the neighborhood, there are a significant number of potholes, sidewalk gaps, and that makes it a lot harder for community members to go outside and get some exercise.
Wow, that is so interesting. While walking these streets, you will also find restaurants, smoke shops, grocery stores, playgrounds, and parks.
And now, here to discuss the diversity throughout the area, Ilana and Sarah.
Good morning, Kayla and Daniel. Today we'll be taking a deep dive into this community's aspects of diversity and inclusion.
The 14216 zip code has limited diversity, with a population consisting of 16,021 white citizens, 3,982 African American citizens, and 1,798 Hispanic citizens. 10.9% of households in this area speak languages other than English at home.
The majority of the population in this community is unemployed at a striking 68%, and 17% live in poverty. This may be due to the high number of younger people that have been moving into the area in recent years. 15.1% of the population in this area are 65 years and older, and 4.2% are veterans.
In terms of education, 53.1% of the population has a bachelor's or higher, while 16.7% have a high school degree and 16.0% have some college. I'd say that's a pretty smart town.
While this area is not the most racially diverse, it excels in its accessibility to healthcare, green spaces, and varying faith-based organizations.
These organizations appeal to varying religions, including Christianity and Judaism. Some we stumbled across are St. George Orthodox Church and Saranac Synagogue.
Healthcare in this area is provided by a range of providers, including Kenton Family Care Center, Community Health Center of Buffalo, Horizon Health Services, Western New York Immediate Care, and Buffalo Rehab Group. There are also alternative medical practices available, including a holistic medicine spot in town.
Certain aspects of the neighborhood maintain strong inclusivity, including the public schools, apartments, and public parks. Other aspects, such as the private Nichols School and Colvin Estates, target a more exclusively wealthy population.
There are many good socializing spots in this neighborhood, including the Buffalo History Museum, Delaware Park, with tennis courts, gyms, and fitness centers. These all promote different aspects of healthy living, as well as the many diverse restaurants around town that Sarah and I might stop by afterwards for a quick bite.
To sum it all up, Daniel and Kayla, this area is not the most racially diverse, but there are other aspects of it that do promote inclusivity. Back to you.
Wow, that was a very riveting rundown. Thank you.
With some more information about health aspects and potential needs for the community, Gianna and Elizabeth.
This neighborhood does a great job of attributing to the 4 health aspect domains, including spiritual, emotional, physical, and social wellness.
This neighborhood meets the spiritual needs of the Christian population in the community. There are a lot of churches when you walk around, ranging from Orthodox, Methodist, Catholic, and there's even a Jewish synagogue right behind us.
Having many different faith-based organizations is so important for an all-inclusive community. This area also has many therapists and social workers who offer telehealth services for mental health treatment, but 2.4% of the population is without healthcare coverage, which raises some concern. 17% of the population is also living in poverty, which may make it more difficult for people to access those online services if they don't own a laptop or personal device.
Yes, Gianna, that is a very great point. It is very crucial to have services that are accessible to all groups, which brings me to the social wellness of the population within this zip code. There seems to be a range of activities that promote social wellness. There's a community center for all age groups, minutes away from where we're currently standing right now. On the flip side, Gianna, while people are socializing in the community centers, parks, there seems to be another bonding with liquor stores and smoke shops, which are very prevalent in this area. How do you think that affects the physical health of the people?
Using drugs and alcohol as a form of socialization can be detrimental to one's health later on in life. It can lead to many problems ranging from addiction, high blood pressure, heart disease, liver disease, and many different types of cancers. In a later segment, we'll have one of our community health nurses touch a little bit more on those topics. But physical health is essential when discussing community health and well-being of the citizens. There are a lot of different primary care doctors in the area, as well as dental, but there doesn't seem to be any women's health or OBGYN services, which is concerning. This neighborhood can definitely improve with the implementation of women's health services.
Thank you. Physical fitness and spiritual adherence are definitely determinative factors when assessing a neighborhood's community health profile. Now speaking with the community health nurse, Kaz.
Hi, Daniel. My goal as a community health nurse is to improve the lives of the diverse community members through education, prevention, and treatment. After assessing the neighborhood, I observed a large amount of liquor stores and smoke shops. Community health nurses can promote awareness about the risks associated with illicit drug use and alcohol consumption by implementing primary prevention strategies such as educational classes to alter these risky behaviors. Secondary prevention strategies include screenings, counseling, and structured help for those at risk. Treatment may include rehabilitation and medications for alcohol and drug withdrawal. Community nurses want to keep the area thriving and healthy, so we target specific needs of each community. Back to you. Thank you, Kaslin. Next, Victoria will have an exclusive interview with a member of this community.
A resident here from the community who would like to share about the recent changes that have been occurring over the past 5 years. So hi there. Thank you so much for joining us. So how long have you been living in the community for?
Hi, I've been here pretty much my entire life, so over 30 years.
Do you have any information that you could share about how your community has been changing over the past 5 years in terms of like diversity, health needs, or anything that is really affecting the residents in your community?
The more homeless with children, average age of the population coming down, and the average rate of homelessness going up. I have to imagine that pediatric concerns have gone up. We have a good number of clinics, a good number of clinicians because of the diversity of our population and because of the number of people we have that don't have adequate insurance to cover their needs. There are a tremendous number of people that rely on Medicaid and not enough facilities that accept it. And our violent crime rate has dropped significantly in the past 5 years.
So do you know if there's any specific concern about like substance use or alcohol in your community specifically?
We like to regard ourselves as a drinking town with a sports problem.
Yeah.
So alcoholism is rampant. And even prior to legalization, that a high percentage of people were driving around stoned. We have problems with substance use here for sure.
Do you know like relatively what the mental health status of community members are?
Judging by the number of addiction treatment facilities and health aid facilities that we have in the area, I'd say we probably have a sizable portion of the population that is in serious crisis.
Do you know if there's been any initiatives or interventions aimed at improving the community's safety?
The Be a Friend program helps to reach out to, I believe, disaffected young boys in general, as to hook them up with a mentor, particularly those that are missing either a father figure or an adult in their life that they can look up to. Since I know for sure that we have a good network of halfway houses, women's shelters for those that are abused.
Okay. Thank you so much for meeting.
Wow, thank you so much, Victoria. That was so interesting.
Stay tuned for the weather up next on BUN News.